Hi, I'm Charmaine Leanne Valdez and I'm going to discuss 2 disorders from breast disorders and 5 disorders from sexually transmitted disease. So, let's get started. So, the first disorder that I am going to discuss is the fibroadenoma. Fibroadenomas are tumors that consist of both fibrotic and glandular components that occur in response to estrogen stimulation. They may increase in size during adolescence, during pregnancy and lactation, or when a woman takes an estrogen source such as an oral contraceptive. A fibroadenoma is a solid lump that often causes no pain in the breast. It is often round with definite smooth borders, easily moved, and firm or rubbery. A fibroadenoma grows slowly and an average size is 2.5 cm. Generally, a fibroadenoma can increase in size over time and may be tender or cause soreness a few days before the menstrual cycle. You may have a single or more than one fibroadenoma and it can occur in one or both breast. Some fibroadenomas shrink over the period and most lumps in adolescence shrink over months to a few years and then disappear. Further, it may also change shape and may get much bigger during pregnancy and shrink after menopause. The healthcare provider will completely examine the patient and the breast will be manually palpated. A breast ultrasound or mammogram imaging test may also be done. A breast ultrasound is an imaging test where a handheld device called a transducer is moved over the skin of the breast, which produces a picture on a screen. A mammogram is an X-ray of the breast taken while the breast is compressed between two flat regions. A biopsy or fine needle aspiration is performed to remove tissue for testing that involves inserting a needle into the breast and removing a small piece of the tumor. The tissue is then sent to a lab for microscopic examination to find out the type of fibroadenomas and if it's cancerous. Moreover, the healthcare provider may advise follow-up review to closely evaluate with clinical breast examinations and imaging tests for fibroadenomas that don't grow and are not cancerous. Other procedures to remove a fibroadenoma include cutting it out. A surgeon uses a knife to remove the entire fibroadenoma. This is known as surgical excision. Next is the freezing. A thin device like a wand is inserted via the skin of the breast to the fibroadenoma where the device gets very chilled and freezes the tissues. This procedure helps to destroy fibroadenomas. So the next disorder is the mastitis. Mastitis is an inflammation of breast tissue that sometimes involves an infection. The inflammation results in breast pain, swelling, warmth, and redness. You might also have a fever and chills. Also, mastitis most commonly affect women who are breastfeeding or lactation mastitis, but mastitis can occur in women who aren't breastfeeding and in men. Clinical manifestations of mastitis include breast tenderness or warmth to the touch, breast swelling, thickening of breast tissue or a breast lump, pain or a burning sensation continuously or while breastfeeding, skin redness, often in a wedge-shaped pattern, or generally feeling ill, and fever of 101 Fahrenheit or 38.3 Celsius or greater. The diagnosis for mastitis is that a doctor will do a thorough physical exam and ask you about your signs and symptoms. A culture of your breast milk might help your doctor determine the best antibiotic for you, especially if you have a severe infection. A rare form of breast cancer, inflammatory breast cancer, also can cause redness and swelling that could initially be confused with mastitis. Your doctor may also recommend a mammogram or ultrasound or both. If the signs and symptoms persist, even after you complete a course of antibiotics, you may need a biopsy to make sure you don't have breast cancer. Mastitis treatment might involve antibiotics. If you have an infection, a 10-day course of antibiotics is usually needed. It's important to take all of the medication to minimize your chance of recurrence. If your mastitis doesn't clear up after taking antibiotics, follow up with your doctor. Next is pain relievers. Your doctor may recommend an over-the-counter pain reliever such as acetaminophen, Tylenol, or ibuprofen like Advil, Motrin, IB, and others. So let's proceed now to the disorders from STDs. The first disorder is the candidiasis. Candidiasis is a vaginal infection spread by the fungus Candida, an organism that thrives on glycogen. Candidiasis is so common that as many as 90% of women will have it sometime in their life. Because oral contraceptives produce a pseudo-pregnancy state, adolescents using oral contraceptives tend to have frequent vaginal candidal infections. If treated with an antibiotic for another infection, which destroys normal vaginal flora and lets fungal organisms grow more readily. They are also particularly susceptible to this infection. Incidence also strongly associated with immune suppression and diabetes mellitus because hyperglycemia provides the perfect glucose-rich environment for candidal growth. Because of the scant mucus production in the period before menses, symptoms may be most acute at this time. The adolescent will notice vulvar and vaginal reddening, burning and itching, and even bleeding from hairline fissures. A thick, cream cheese-like discharge can usually be observed at the vaginal outlet. Internally, the vagina shows white patches that cannot be scraped away without bleeding on the walls. There may be accompanying pain on coitus or tampon insertion. Candidal infections can also be present at other body sites, such as the oral cavity or a moist area such as the umbilicus. In immunosuppressed individuals, candidal infections can become systemic. Candidal infections are diagnosed by removing a sample of the discharge from the vaginal wall and placing it on a glass slide. 3 or 4 drops of 20% potassium hydroxide solution are then added, and the mixture is protected by a cover slip. Under a microscope, typical fungal hyphae indicate the presence of candida organisms. An at-home test kit Vagisil screening kit is available, which gives result instantly. A woman inserts a pH wand into her vagina and in a few seconds compares the color of the swab to a pH color chart. If the reading is above 5.0, it suggests she may have a bacterial infection and should see her healthcare provider. A pH level of 4.5 plus itching and or burning unusual discharge or a yeasty odor suggests a yeast infection, and it would be alright for her to use an over-the-counter treatment. Therapy for candidal infections includes vaginal tablets or cream applications of antifungal preparations such as over-the-counter miconazole or clotrimazole once a day for 3 to 7 days. Oral fluconazole diflucan can be administered as one-time dose. Teach women to insert antifungal tablets or creams at bedtime so the drug does not drain from the vagina immediately afterward. Treatment should not be interrupted until it is complete, even during a menstrual period. If a girl has frequent candidal infections, her urine should be tested for glucose to rule out diabetes mellitus. If she is using an oral contraceptive, she might be counseled to use another reproductive planning method. If an adolescent is sexually active, treatment of the male partner may be necessary to break a reinfection cycle. Pregnancy and candidiasis. Candidiasis occurs more frequently during pregnancy than usual because the increased estrogen level present during pregnancy causes the vaginal pH to be less acidic and even more favorable for yeast growth. Women with repeated infections should have their urine tested for glucose to determine whether gestational diabetes is present. Both miconazole for 7 days or a single dose of oral fluconazole. Moreover, diflucan are approved for use during pregnancy. Treating the infection during pregnancy is important not only because the profuse vaginal discharge and pruritus are uncomfortable but also because if the infection is present in the vagina at the time of childbirth, it may cause a candidal infection or thrush in the newborn. Caution: pregnant women to call their primary healthcare providers before using an over-the-counter product to double-check that the product is safe to use during pregnancy and also so that primary care provider can know a vaginal infection is occurring. So let's move on to the next disorder, which is trichomoniasis. Trichomonas vaginalis is a curable STI and has the highest prevalence among adolescents. The incubation period is 4 to 20 days. A serious consequence of trichomoniasis is that infection can cause such genital inflammation that it makes it easier for the person to be infected with the HIV or to pass the HIV onto a sex partner. With a trichomonal infection, female may notice only a slight vaginal discharge or else notice extreme vaginal itching and a frothy white or grayish-green vaginal discharge. The upper vagina looks reddened and may have a pinpoint petechia. A pap test taken during this time may be misinterpreted as showing abnormal tissue. Males with the same infection tend not to report any symptoms. The infection is diagnosed by microscopic examination of a sample of the vaginal discharge. Trichomonads typically appear as rounded mobile structures. Oral metronidazole or tinidazole eradicates trichomonal infections. The use of condoms by sexual partners helps prevent the recurrence of trichomonas in both parties because metronidazole interacts with alcohol to cause acute nausea and vomiting. Caution older adolescents and women to not drink alcoholic beverages during treatment with this drug. Pregnancy and trichomoniasis. Trichomoniasis infections are associated with preterm labor, premature rupture of membranes, and post-cesarean infection. The drug of choice during pregnancy is single-dose oral metronidazole. Although classified as a Class B pregnancy drug, it may not be prescribed during the first semester of pregnancy to avoid detrimental fetal effects. So the next disorder is bacterial vaginosis. Bacterial vaginosis is defined as the absence or deficiency of lactobacilli in the vaginal flora, and it occurs frequently among women of childbearing age. The clinical manifestation of bacterial vaginosis are intensely pruritic vaginal discharge, appears milky white to gray, and has a fish-like odor. Microscopic examination of the discharge shows gram-negative rods adhering to vaginal epithelial cells termed as clue cells. Like trichomoniasis, bacterial vaginosis can increase a woman's susceptibility to other STIs such as herpes simplex virus, HSV, chlamydia, and gonorrhea, as well as HIV. The treatment is oral or vaginal metronidazole for 7 days. The woman's sexual partner should also be treated to prevent the recurrence of the infection. Therapy with probiotic lactobacilli to change vaginal organisms is a future possibility for the prevention. Pregnancy and bacterial vaginosis. The treatment during pregnancy is oral metronidazole or clindamycin for 7 days in order to prevent preterm labor as well as premature rupture of the membranes. So the next disorder is chlamydia trachomatis infection. Chlamydia trachomatis infections have become the most commonly reported bacterial cause of STIs in the United States. The incubation period is 1 to 5 weeks. Symptoms include a heavy grayish-white discharge and vulvar itching. Diagnosis is made by identification of the organism, which can be done at the point of care with a urethra or cervix swab. A urine specimen can be used as an alternative screening method. Therapy is oral doxycycline for 7 days or azithromycin as a single dose. Because the infection has become so common, most public health departments require that the infection be reported to the health department the same as other STIs such as gonorrhea, because there is a strong association between gonorrhea and chlamydia. If a chlamydial infection is documented, women are usually tested for gonorrhea as well. Long-term effects of chlamydial infections are PID, possibly leading to subfertility. Chlamydia in pregnancy. Screening for chlamydia via a vaginal culture is usually done during a woman's first prenatal visit. If a woman has multiple sexual partners, screening may be repeated in the 3rd trimester. Doxycycline or vibramycin, the therapy for non-pregnant women, is contraindicated during pregnancy because of possible fetal long bone deformities. Azithromycin or amoxicillin is used instead. A woman's partner also should be treated to prevent her from becoming reinfected. Chlamydial infections must be treated during pregnancy because they are associated with premature rupture of the membranes, preterm labor, and endometritis in the postpartum period. An infant who is born while a chlamydial infection is present can develop conjunctivitis or pneumonia after birth. And the last disorder that I am going to discuss is the human papilloma virus. The human papilloma virus, HPV, causes fibrous tissues overgrowth, sometimes called genital warts on the external vulva, vagina, or cervix. The infection may be present in as many as 10% to 30% of women and is most common in women who have multiple sexual partners. Children, both male and female, who develop an HPV infection should be further investigated for sexual maltreatment. The clinical manifestations are lesions appear as discrete papillary structures. They then spread, enlarge, and form large cauliflower-like lesions. Therapy for such lesions is aimed at dissolving the lesions and also ending any secondary infection present. Small growths often fade by themselves, although they can be removed by applying podophin, a wart removal medication. Large lesions are removed by laser therapy or cryocautery laser or knife excision. Related to this, women who have had one episode of infection should be conscientious about having yearly pap tests for the rest of their lives, and men should be conscientiously inspect their penis for any abnormal growths or ulcers. The vaccines Gardasil or Cervarix are recommended as part of routine administration to both early teenage girls and boys to prevent such infections. Approach the subject of immunization with parents and teenagers with sensitivity because some parents and children are not ready to admit they might be or will soon become sexually active and need this protection. Pregnancy and human papilloma virus infection. HPV lesions tend to increase in size during pregnancy because of the high vascular flow in the pelvic area. They may become secondarily ulcerated and infected. When this occurs, a foul vulvar odor may develop. Photophylum is contraindicated during pregnancy because of possible toxic that affects on the fetus. Trichloroacetic acid, TCA, or bichloroacetic acid, BCA, applied to the lesions weekly may be effective and can be used during pregnancy. Women who do not find the lesions bothersome may choose to leave them in place until the postpartum period and have them removed then. Remind them in the meantime that the lesions are infectious and can spread to a sexual partner. The presence of vulvar lesions appears to have no effect on the fetus during pregnancy, but if they are so large, they obstruct the birth canal for birth. A cesarean birth may be scheduled.